We are live.
Hello, everyone. Welcome to another one of Universal Healthcare Foundation's conversations, Advancing Health Equity by Addressing Racial Injustice, a conversation with two leaders, a timely topic indeed, and a continuation of one we started a few weeks ago. This is the fourth in our series of online conversations regarding some of the most critical issues the COVID-19 crisis has illuminated. I'm Frances Padilla, president of Universal Healthcare Foundation of Connecticut. Our mission is to achieve a health system that includes everybody and that gives access to affordable, quality, and equitable health care and that promotes health. We situate the fight for health justice squarely within the fight for social justice. Health runs through all other elements of our lives. We need our health to be able to work, to study, to thrive, and to realize our potential. We all know that racism is baked into the fabric of our society and that racial inequities significantly affect Black and other people of color in their ability to live healthy and productive lives. So today we're going to continue the conversation and focus in on how we can advance health equity by addressing racial justice. I have two of the deepest thinkers I know about this very issue. Both are activists and advocates and dear friends and fellow warriors in the pursuit of social justice. We're going to talk about some ways to actually address racial injustice and advance health equity. We'll talk together for about 20, 25 minutes, and then we'll open up to questions from our audience. Please remember to write your questions in the chat box, and Rose Ferraro from our team will read the questions and she will pose as many as possible. I'm so happy to welcome Stephanye Clarke. She's currently a program officer at the Community Foundation of Eastern Connecticut. And just prior to that, I'm proud to say she was Advocacy Communications Fellow and Communications Coordinator at Universal Healthcare. Also with us today is Dr. Tekisha Dwan Everette, Executive Director of Health Equity Solutions. Health Equity Solutions is a leading organization focused on achieving health equity in our state. Thank you, Tekisha, for taking time from your vacation to be with us today. Let's jump right in. I'll start with a question for you both. Let's start with defining health equity. Help our listeners understand what health equity means and why it's important to know that it's different from equality. Either one of you can jump right in.
So I'll start. So thank you so much, Frances, for this opportunity today in this conversation. And then, as you mentioned, I am on vacation, though not having fully vacated Connecticut. So I'm a little bit more casual in my look today than I usually would be, but hopefully not any more casual in my communication than normal. So the concept of health equity for me is simply the understanding that from a health perspective, we all haven't started at the same place. So we need different resources and different things to get us to that optimal level of health that we all should enjoy and expect to enjoy in our lives. It's the recognition that while equality is something we've all longed for and have stated is the right thing to do, that without addressing the fact that our starting places were uneven or not equal, we can't get to that state of equality. So it's an interesting concept for me, and that says in order for us to be equal, we have to actually be equitable. And we have to acknowledge that people need different resources and different things. And so concretely, that looks like advocating for or having in place different tools and distributing our resources differently to make sure that everyone has the opportunity to get to optimal health. So that's my kind of long-winded way. If I had to put it in a short, like one sentence, I would say health equity is the opportunity for each of us to live at our healthiest selves, our best, healthiest opportunity without any of the social barriers that man and woman have created in our society.
Mm-hmm. So I think this idea that we don't all start from the same place is really an important one. And Stephanie, I'd like you to expand on that a little bit more.
So I was thinking about some of the other things that we were thinking about talking about today, right? And one of the social determinants of health that I loved focusing on when I was at the health department had to do with housing. And so I'm just going to take just a couple seconds just to talk about housing and how that translates into health stuff. After the Second World War, there's a housing at the whole urban renewal thing, where when the GIs came home, there was about $120 billion that was set aside so that our returning GIs could build homes. At issue was that less than 2% GIs of color were able to access that money. So that locks them out of home ownership opportunities, right? And so suburbia is completely underwritten by the federal government, and it's okay to discriminate against GIs of color. So when you lock folks out of home ownership opportunities, you also lock them out of the ability to build wealth, to send their kids off to college using that money. And you know, the GIs who did get the money were restricted to these red zones, where we all heard about the redlining, and while it's technically not legal anymore, that history still impacts our communities today. So if we think about how housing and property taxes fund public education, how our communities are designed. If you think about most of our urban centers, there's very little green space. There are convenience stores everywhere, liquor stores everywhere. Supermarkets are hard to get to. So housing policy, discriminatory housing policy, help shape and design our communities. And then we have folks who have limited income, transportation, access to wealth, access to education, employment status, sort of living in these economically depressed communities with very little resources, and that influences their health, all the stress, all the lack of access to physical activity, healthier food options, quality healthcare services. So,
well, I think what you've painted is a really great picture of how policies in one area affect policies in other, and how health actually runs through them. And so when we talk about equity and we talk about social determinants of health, I think I'd like to talk about Connecticut, right? And your example of housing. I mean, we know that it's been a long history of redlining in Connecticut along housing, about housing. Let's talk about how we can here in Connecticut at the state and local level address racial injustice by changing policies related to those social determinants. Tekisha, you want to take a crack at that? I'm not hearing you.
I have a double mute situation, so I'll start. This gets me every time. I'll start and then I'll kick it to Stephanie. So I think the key is that we first have to acknowledge that that racism is not just at the interpersonal level, and that there are institutional and structural manifestations of racism that we are currently living through and living with today. So, I mean, the quick of this is to say that most times when we talk about racism, people instantly get into this defensive, oh, you know, I'm not racist. I like everybody. I have a Black friend. And people liken this conversation about racism to just one of Blackness, which is important. And I'll come back to that later. Fundamentally, what we need people to understand is this isn't about an individual conversation of whether you or I like each other based on our thoughts or notions of skin color. It's really rooted in the fact that from the origin of our country, we designed a country where we created a class of people based on race. we created this notion of whiteness, we created this notion of Black people, and we then funded and provided economic opportunity, educational opportunity, housing opportunity, as Stephanie mentioned, along those lines. So we've got to acknowledge that that's the country we built. That's our origin. And then ever since then, we have created policy after policy after policy to respond to or reaffirm that which was already developed. So in order to undo that, in order to dismantle that, we first have to acknowledge the truth and the reality that we have not addressed that. We haven't gone away from that. We haven't addressed the inability of African Americans in this country to build generational wealth, and that we haven't addressed the lack of education, that was the intentional lack of educating Black slaves, and how that has detrimentally harmed and disadvantaged communities, both economically, health-wise, et cetera, et cetera. Now, once we've acknowledged that, acknowledgement is not enough. It's great. A lot of people know, Francis, you know, right now, Health Equity Solutions is going town by town, trying to get them to declare racism as a public health crisis. And that's important. But what's important is the actions we take after that. It's the point of looking at our budgets and how we are budgeting in our state, even locally, how we are budgeting, the things we are giving our money to and things we are not. One simple example I'll give, taking off of what Stephanie said earlier, is when we built communities, there's not a lot of green space in urban centers in a lot of places. Now, Connecticut has done this a lot better because it's New England and center greens have been a thing for a variety of reasons. But let's just follow this through for a second. If we are putting money in parks and recreation in the budget, and we're designing this in everybody gets the same amount, or this year we're going to focus on building parks in these 10 places, and those 10 places are the suburbs and not our urban centers, is that an equitable thing? Are we doing the right thing? When we talk, we can take that, that's an easy one to unpack and then do, because everybody believes in parks and everybody believes that we should have recreation. But now let's tackle the harder conversation about how we're doing our education spending. Let's do the harder conversation about how we're doing our healthcare spending. So this is where we have to start taking these actions and recognitions and moving into policy change that says we have to do things differently. And I could go more into that, but Stephanie, I'm sure you have something you want to add to this. And I know Francis, you know, you got to catch me, Francis, because I'll just keep going and talking. And I know we want to.
No, I'm with you, and I have a follow-up question, but so you know, it's interesting because I think there's a few levels here, right? One is acknowledging that there is a problem, acknowledging that this exists and that it's endemic and it's implicit and explicit. And that's really hard for a lot of people because they see racism, quite often people see racism as an interpersonal, as you've pointed out. From a policy perspective, it's about looking at policies through an equity lens. And we don't have skill as a society in this country at looking at policies through an equity lens. And so I'm really struck by, right, if we're going to undo some things and rethink how we underwrite and how decisions get made about resource allocation, then there needs to be an equity lens. And how about, and I'll throw this question to you, Stephanie, because you might have some opinion, like, how about if we really did impact assessment, health equity impact assessment against policies?
I mean, absolutely. You know, there was a point in time locally here in London where an old school was about to be raised, and a community of folks who were living in some low-income high-rises, they were talking about moving folks from that property to this smaller property. And I thought, first, that's crazy, first of all, because it's like on a business district and there's nothing but fast food restaurants everywhere. And none of it made sense to me. And then I thought about, well, how is the health of all the residents, the people who are already living there, plus the 120 something families that were trying to move into this squished space? Like, how does that work? And there was no discussion about that. And I said, so we are talking about relocating people who have limited income and other resources, and we're going to move them from one area to the next without discussing the poverty that has them living where they're living. And we're not going to talk about what this could do to their health. And so every time I brought it up, it was just kind of quieted down. So I feel like we definitely need to be talking about every decision we make at planning and zoning, at the city council level. How does this decision that we're going to make, how does this money that we're going to spend, how does any of this impact people's health? And if we're not doing that, then we're being irresponsible.
Are there any promising examples here or anywhere else that, we want to talk about solutions, right? We want to talk about moving from where we are, acknowledging what needs to be acknowledged, to solutions. Are there any promising examples that either of you are aware of?
I'm going to say a few, but before I do, I might actually just say one or two, but before I do, I want to say one controversial statement. At least I think.
Go ahead. I
think it's forward thinking in a way, but I think the question of promising solutions is a false question in a way, because it makes us think that we have an example, particularly in the United States, that's pointing to real dismantling of racism. So what I mean by that is I've not seen any complete city, state, or even our nation say, listen, we're going to have a truth and reconciliation on racism, and we're going to acknowledge what it has done and what we have done and how we are complicit in it, and we are going to do what's necessary to dismantle and overhaul. So it's challenging for me, because I guess that's my North Star, is like, if we're dismantling racism, let's take it down. We haven't seen that, right? Here's what I can say we have seen that's promising. We've seen the, oh my goodness, I'm losing the name of it. It's a county in Wisconsin. I can't think of the name right now, but we've seen a county in Wisconsin that has declared racism a public health crisis and has now created a budgeting tool to change their budgeting strategies in order to address that race equity. So, right, we've seen some action there. We've seen right here in Connecticut the ability to do racial equity impact statements in the legislature, which passed now 2 years ago, to go beyond just our judicial work, but now going forward and looking at any bill can be requested to do that. Now, we haven't funded that. So we've taken the one step to do it, but we haven't funded staffing in order to actually create that. We've seen, and it's really interesting to point to Hennepin County in Minnesota, particularly given the George Floyd murder and how that happened in one of the states we herald the most at doing good work around health equity. But we've seen Hennepin County do real work at analyzing and using data to really best direct their healthcare decisions. So those are some promising things that we have seen. But I do think we have to get to that higher conversation, where as a nation, we are facing the facts that we need to address our history and really undo the things that have been, that we have done and continue to do related to it.
Well, that I agree with you on that point, and I recognize that the challenges of having it happen, and these past months of civil uprising around the country has demonstrated that we are fed up as a people. We are fed up, and that there does need to be that kind of change, and that we need to do the hard work. Which means, holding political leaders accountable, running for office, doing all of those things. So maybe one of my questions is, power, like, how do we build the power? Where does voting and advocacy come in here with respect to dismantling racism? I
feel like I keep talking. So Stephanie,
I need you to, you're going to jump in. I know you are.
but I said this today, because somebody asked me, Someone asked me this question, I'm like, you know, so this racism thing is a public health crisis. Okay, I get that. That's great. But what do you do if the people in power don't want to acknowledge racism? They don't want to address it. And I simply said, well, people are not in power, people are empowered. And you empower people to represent you by your vote. So if you don't like what someone is doing, you've got a couple of options. You can run for their seat. There's a whole campaign right now that's called Your Seat Ain't Safe, basically letting people know you may have been in office for years, you may have been elected by the people, but the people are the ones who elect you, and you have to be responsive to them. So you have options. If you don't like what the people who are elected to represent you are doing, then you can run for that office. If you're not one who desires to run, you can vote them out of office. The thing that we just really have to get to the point of the realization, I think, in 2020 is that we have agency and authority at every single level of who we are. And we can't let people take that from us. So we have to be active participants in the change we want to see. We can't just sit home and complain about it. And here's the thing, when I say we can't sit home and complain about it, I think that the people who are demonstrating and protesting, the folks who are stopping in their cars and watching police officers as other people are being pulled aside, the folks who filmed George Floyd's murder, those folks are showing that that's their level of activism, and they may not be able to go further, but we owe it to them. We owe it to the ones who are losing their lives, and we owe it to the ones who are saying, I will not be an innocent bystander anymore, to stand up and not complain about it, but do something about it. And the last part I want to say this, and Stephanie, I'm going to go right to you next, because you gotta get in.
I have a question. I think along the lines that you started, Tekisha. Stephanie, how can white allies be partners in this work? And let's say white allies who believe in universal health care, how can they be part of the struggle for it and advance racial and health equity?
So,
and I'm going to ask you, like, address that question from right where you are in a local community, right? Working in local.
So a couple things. I struggle a bit with folks who declare themselves to be allies, right? I watched the presentation maybe a month or so ago where the facilitator said flat out, you don't get to say that you're an ally, right? It's really that your work that shows that you're an ally. And then the folks who are living, marginalized communities, for lack of a better phrase, but I hate, but the folks who are disparately realizing all of these systems and all of oppression, we get to let you know that you're an ally. So that's number one. Another part is to listen, right? And I understand having good intentions and wanting to help, but sometimes it requires, a lot of the times, it's gonna require you to just be a little bit more quiet and sit back and listen to the folks who are greatest impacted by all these systems. Because when you don't, you are still perpetuating the thing that you say that you are about trying to dismantle and fix. So, that's another way that while we do this work together, that we are still sort of oppressed. It's just like, well, I know this thing and I am more skilled in this than you are. And it's just like, yep, but I'm living it. And like Tekisha said, I have agency, I have authority. So I need you to step aside and listen to me. And if there's a space that I cannot get into, that you can get into, then I'm gonna need you to get in, crack that door so that we can walk in. But for me, it really requires a bit of needing to know to step up and to step back.
Yeah, can I add to that?
Sure, of course.
I love what you said about step up and step back. I think it's also don't let your help be oppressive. So it's one
Yes.
of these things like don't foster. So I can't remember what organization I was in, but I served on a board, and one of the things they said, and it lasted with me, is that oh, I know who it was. Francis, you know who it is too. We strive hard to not recreate the oppression we're trying to fight in the world in our organization. And so when you're talking about allyship, it's really that point about saying, think about how you stand for me when I'm not there, as much as you stand for me when I am there.
Right.
And how are you not creating oppressive structures when I am there, right? Like, what does that look like? And making sure that the other piece that I want to say that, because a lot of people want to say, you know, how can I help? The way you can help is recognizing we are all impacted by racism. This is like, I mean, each and every one of us, it's different. The impact is totally different. You don't stress, you don't have the stress necessary that I do about being stopped by the police or having to stand by and watch somebody who is being stopped by the police. But the impact of racism is still as real in terms of what your culpability is, as well as your impact in terms of being able to have a healthy, thriving community as a white person. So, I mean, those are my things. And then the last part is allyship is cute. I'm on vacation. I'm sorry, I did it. I just slid right in there. So let me rephrase. Allyship is great, but you have to turn that allyship into advocacy. And it goes back to that first point about what are you doing when I'm not in the room that advances and dismantles racism?
Well, you know, it's a lot of what I've been observing in these months is that there's a call to name racism, because there's a call to name it, and for white people to name it. And it's struck me as interesting. And, you know, what does this have to do with health? I think it has everything to do with health. It has everything to do with health, because when we are invisible, when Black people are, I don't see color, then you don't see me. You don't see who I am. And so that whole idea that we sort of talk around it, but don't. There was an op-ed in the New Haven Register last weekend from a white man who wrote saying that, you know, he has really been thinking hard about the fact that as a white man, he's never had to worry about being stopped by police. That when he was younger, he had a beat up old car that he lent to a friend of his who needed it to get to work. And in the 2 years he owned the car, he had never been stopped. And in the 5 months that his buddy, who was Black, used the car to get to work, he got stopped multiple times. And that he never stopped then to think about the fact that it was because he was Black. And his call to action was, wait a minute, I gotta stand up now and call a spade a spade. There is racism. It exists, and I can't just stand by quietly. I wanna make sure that we have time for people in our audience to ask you guys some questions. So I'd like to open it up. Rose Ferraro from our staff is gonna read the first question.
So I encourage people to put questions in the chat as we have these two great leaders to answer them. But while we're waiting, I did want to hit on how the concept of targeted universalism might fit into the fight for racial justice and health equity.
Okay, targeted universalism. You want to define what that means so everybody understands what we're talking about?
Sure. Steph, do you want me to go or you want to take it?
Steph, you want to take it? No?
So John Powell is a scholar, a race scholar at Berkeley University in California, very much known for targeted universalism and this concept. And the way, I'm not going to do it justice as John would. I say John like I know him, as John Powell would, but I'll say the way I think of targeted universalism is my focus on solving policy issues is to look at who is the most differentially impacted by whatever decision is or structure or problem I'm trying to resolve. So if we take COVID-19, for an example. Who's the most differentially impacted or disproportionately impacted? People of color contracting the virus at higher rates and also showing up in the death rate at higher disproportionate rates. Then what I need to solve for and build is a policy solution that fixes their issue, because by doing so, everyone will be served. So to me, it's the notion of a universalist approach that's targeting the most disenfranchised. I don't like to use the word marginalized, but if marginalized makes sense, we'll use that. Vulnerable, I can't stand that word either, but vulnerable as well. But if we target to make sure that their issues are addressed and fixed in the system, then we will have a system that can work for everybody, or work for the most, if you will.
Well,
And so, go ahead.
No, go ahead. Finish your thought.
And so what Rose asked about is that a strategy? I mean, it speaks to who I think, it speaks to how I see the world, and who I seek to make sure that we create policy solutions for. So I think it's one of the most important tools that we have in our toolbox in dismantling racism and addressing and creating and fostering racial equity.
Steph, you want to add to that?
So for me, it literally, like Tekisha just mentioned, it literally sounds like the work that all of us are doing, right? So it's really about seeing who is greatest impacted and making sure that the resources are distributed according to that need. And by doing that, everyone wins. Simply.
Mm-hmm. Yeah, you know, I think what John Powell specifically is critical of and cautions, I think the word is caution. He really cautions that universal health care, it could inadvertently actually exacerbate disparities if we don't think about the design of how to benefit people of color first, poor people first, so that universal health care is designed in such a way that if it benefits them, it benefits everybody. And it's like flipping the narrative.
I mean,
that rising tides don't necessarily lift all boats.
I completely agree. I mean, I think that's the kind of the focal point. And it's there are two things that have been said recently that really get me excited about this, that I think help people see it, right? The rising tide lifts all boats. I'm gonna go ahead and shout out my friend and colleague, Cincy Hernandez Cancio, because she helped me to see this really well. She tells the story about, rising tides can lift all boats, but if the boat already had a hole in it, yes, or the boat has a hole in it, what happens? That boat sinks, and it still continues to capsize. So you have to recognize the fact that we can't continue to make solutions on top of solutions that have already been broken, right? They're colonized. Like the other thing that I love to say, and shout out to Dashni on my staff who tells me to say this every time I can: colonized minds create colonized solutions to colonized problems. So the fact that we don't have universal health care, and that we have health care that's based in employment and it's broken and disparate as it is a problem already. And now we're trying to create a problem. We're trying to solve that problem by creating a problem within that box. We're thinking about it that way. If we don't flip it, all we're going to do is create a more challenged system on top of a faulty one already. So to be clear to the listeners, and Francis, you already know this, it's not to say that universal health care is a problem. It's about how you design the response that will make a difference.
Right. I want to go to another question from our chat box. Rose?
Absolutely. So this comes in. So the question is, there are so many social determinants of health, such as racism.
We lost you, Rose. Sorry, Rose, we lost you. So we'll come back to you in a few when you're back on audio.
Hi, can you hear me?
Rose, we lost you. Can you state the question again, please?
Can you hear me now?
Yes.
Perfect.
Okay.
I can hear you guys. Sorry about that. There are so many social determinants of health, such as racism and housing. Do we need to first dismantle those issues before we can get to health equity? Or is there some steps that we can take now in order to get closer to equity?
All right. Stephanie, you want to try that one first?
So for me, they're all interconnected. All of our social determinants of health, housing, transportation, social capital, the whole list, are all influenced by racism. And so I feel like instead of like just picking housing and like desegregating, our state, or like focusing solely on transportation, they need to be done concurrently. And we need to talk about how racism impacts each and every one of those systems, and then like get to the solutions and how, because if we do that, if we talk about how racism impacts them, and then we can figure out what to do so that the outcomes will be different.
I think that's right. I mean, racism as a social determinant of health, it's kind of an interesting juxtaposition, which comes first, right? And I had a conversation recently with another person who said that we have a racist system, right? That racism is a system in and of itself. And so the question is how, if you don't tackle everything at the same time, you're actually losing opportunity. And I'm gonna ask you, Tekisha, what do you think about that?
Well, the reality is racism is not a social determinant of health. Discrimination is the determinant. So the way in which it manifests itself is the determinant. Racism is the foundation. It is the system on which all of the social determinants of health we see and how it impacts different people impact them. And this is a challenge for people to understand, because you want to talk about Appalachia and whites in rural communities who are also experiencing some awful health outcomes. And by design, that's a question about class. All of this has a relationship to class, but by design, that's rooted in separation of whiteness from Black people and people who were used to be similarly co-located economically, whites and Blacks, who were separated and created into a different class. But that's a different conversation for a different day. I think I want to make this point of saying racism is the foundation, and in order to address any of those things, we have to address it. And fundamentally, I want to today is my day to be controversial. Sorry to everyone listening, because you're getting me on a little bit of a relaxed mode, so I've had a moment to think about it. One needs to, when we talk about racism being the foundation and having to dismantle it, and thinking about how dismantling it through the execution of policies, what that looks like, it makes you ask the question, is desegregation the problem we're trying to actually resolve? Because when we think about this as the comment of saying segregation is a problem, yes, it is. So listen carefully. I'm not saying it is not. But what segregation and addressing segregation then leads you to is the joke that I usually put about health equity and disparities. I'm going to flip it and talk about it from segregation and desegregation. If you aim to solve and resolve segregation, that says, well, we just need to move more Black people to be co-located next to white people, and that's when we'll care about them. That's not what we're saying. That's not the point. The point is that when you segregate communities and then you disinvest in them, you have a concentration of poverty. You have redlining that diminishes their ability to pay taxes, and their taxes cannot fund the educational system. So the question really then again is not about resolving segregation through moving people to other places. It's about solving and dismantling the racism that created the segregation and therefore created the disinvestment. Exactly. So this is a real long way of saying both and, because I think the question was about, do you tackle one at a time or do you do it all together? You got to understand the system, and the system is designed to produce exactly what it is designed to get. And that's what we're getting right now. Exactly. We're getting the results of what the system was designed to give us. We got to break the system.
Well, we are running out of time. We have maybe 3 or 4 more minutes. And we could certainly keep this conversation going for a good while longer. I want to ask you both a couple of concluding questions. One, what keeps you hopeful? And two, what would you say to our listeners is your call to action today?
So for me, what keeps me hopeful, most hopeful in this moment is watching our young people. This is the year I turned 50. And I am super excited about that, right? But more than anything, I love the unapologetic passion of our young folks who are just saying enough. Like, we're done talking, we're done sitting down, we're done laying down, and they are doing the work. And I'm so inspired by them. That's what's keeping me sort of from just checking out altogether, just watching them. And then my call to action is, don't be a bystander. Like, you have to show up and participate. There are many different ways, as Tekisha alluded to earlier, that we can participate. But just, you can't not participate. You can't.
Voting is a good way to participate. Tekisha, what do you think?
I echo what's giving me hope every single day is the young people who, and this is interesting to say it this way, the young people who are far enough away from civil rights that they've only lived the actualization of them and not the struggle. So they only know that struggle through history, but not lived experience. And the reason I say that gives me hope is because they have no other barrier to success. They have no limitation in their mind about what change needs to look like. They're demanding big change. They want big change. And they're not gonna stand down for anything less. So that's making me wake up every single day and try to be, someone recently made me cry because they said one day I'm going to be seen as someone's ancestor. And so I'm trying to be the deserving ancestor. I'm trying to be the ancestor they deserve and get out of their way. And so getting out of their way is the part of my call to action. We need to not be bystanders, but we also don't need to stand in the way of change and stand in the way of these young people who are demanding and creating the change that they want. Paired with, we need to do a few concrete things. So this is where the pen comes out, but you actually don't need to write it down because it's real easy. You need to vote in every election. August 11th in Connecticut, if you're listening to me, is coming. Vote. If you're doing an absentee ballot, fill it out, vote. If you haven't completed your census, get the census done. We need that. It's important. We need to make sure that we are counting the Black and brown people who live in this country and that we are showing up on the census because that directs where the money comes from. And then the next part of it is, if you so desire, run. And when I say run, I don't mean run from people, I mean run for something. Run for office. If you believe that we need to have equity, if you believe in the concept of equity, racial, gender, it doesn't matter, then I say, put your platform together and get out there. We can do this. We can make this change together, and collectively we can be the change that we want to see. And finally, if you see something, don't not only say something, but do something. Like and that something can be as small as a vote, but it could also be as big as you running. And know that I am here. Health Equity Solutions is here. We are here for this fight. Stephanie is here. Francis is here. Universal Healthcare Foundation is here. That's my call to action. Let's get it done. I'm ready.
Thank you. Thank you both. Thank you very much for that note, because that's right. We've got to keep fighting. We've all been fighting in the trenches for a very long time. The fight continues. We need all our warriors standing shoulder to shoulder together. Thank you again so much. And I appreciate everybody who's come on today and listened to us, and stay tuned for more. Take good care, everybody. Bye.
Thank you.